Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
This is something that not too many people know about, and I was very fortunate to find Dr. Gino Tutera, who's a real specialist in hormone replacement. Now, we read about hormone replacement, but people really don't know what it is, and there's all kinds of hormone replacement. So welcome to our show, Dr. Tutera, and tell me why you're involved in this.
Well, being a board-certified OBGYN, I've been involved in hormone replacement in women since 1971. So it was a natural for me to continue to search and try and find the most optimal way of creating a normal physiologic state for my female patients. And I realized in the mid-'70s that the usage of bioidentical hormone was probably the best route to take. But I was dissatisfied over the years with the usage of the topicals, and such as creams and gels and lotions. And I think that I've used every format there is to deliver these hormones. And when I found pellets, I found a methodology that allows me to actually make a beneficial impact on the internal physiology of each and every patient. And we do that by the usage of the hormone, as well as I created an individualized dosing algorithm that is basically patent pending, that so that it would be like me sitting in the room in case for the physicians that I train to use my methodology there in the patient. So it's been very soul satisfying to see the results that I have created for patients, and nothing more wonderful than people coming in and telling me that their lives have changed after a 4-week period of time.
Excuse me, I am so glad you're doing this, because how often did we hear, oh, she just, what's wrong with her? She's just a problem woman, and no one really understood what you apparently understood so many years ago. So you were saying that pellets, though, are superior to using creams, pills, or patches. And exactly why is that? Because, is it an exact dose? Is that why?
Well, it's not only that, but it's the only form of hormone delivery that allows the body to actually control the release of the hormone. And that's effected through the effects of brought about by change in heart rate and change in cardiac output, or stroke, basically the amount of blood pumped out with each ventricular contraction. So if you think of it, I always liken it to the pellet being a lollipop and the body being a kid licking a lollipop, so that when physical or emotional stress enters into the system, the body will respond by acceleration of the heart rate, and that internal child then will lick much more furiously on that lollipop, releasing more hormone, especially during those boot camp exercise patterns or heavy physical labor or significant emotional stress.
So the pellets, how often are they inserted?
Well, for women, it's about 3 times a year. For our male patients, it's about twice a year. And it's incredible phenomenon. I've been on them personally for 15 years, and I can tell you at this very moment that if I had not been on the pellets, that I wouldn't be as functional as I am now, both physically and mentally, nor would I be able to work the schedule that I'm working, and be able to help as many people as I continue to help with the vigor that I had even 15, 20 years ago. In fact, I got more vigor now than I did 15 years ago before I started college.
Well, so for women who are in menopause, and many have vaginal dryness, they have a lot of other problems like that, is this one pellet that they're going to take once or twice a year, that's going to relieve them so they don't have to take estrogen and other kinds of testosterone?
Absolutely. They get individual pellets, one for estradiol and either 1 or 2 for testosterone, depending on their need. and those pellets will last a good 3.5 to 4 months. And for some ladies, maybe even a little longer, but that's a small percentage. But so I tell everybody on the average 3 times a year. But it helps because of the constant presence of hormone, and that's the difference between using topicals and the other forms, is that the outflow of estrogen is continuous. So as you can think, every fraction of a second, every time the heart contracts, you're getting a dose of hormone, and so therefore it helps recreate the ovarian secretion pattern, therefore eliminating the need for any other supplementation and being able to get the beneficial effects such as improving vaginal moisture, thickening the vagina. I can't tell you how many women we've treated who their stress urinary incontinence has improved because of the increased improvement in the urethral sphincter and the pelvic musculature.
Well, you are in Arizona. How do you treat people here in Florida?
I've got a number of physicians in Florida that I've already trained, and they're mostly in the southern Florida area. I have in northern Florida, up in the Jacksonville area, there's Dr. Seekine, who is a excellent OBGYN that has been using the pellets now for a number of years that I train, and he and the folks in southern, and there are a number of them in southern Florida that I have trained that are able to do exactly what I do.
This is incredible. Well, I know I had gotten information about you, and I knew I wanted to talk to you, but I didn't know how much I wanted to talk to you.
Thank you. That's very kind.
Really? I mean, I have had radio shows for 25 years, and I've had a lot of people work with all sorts of things like this, gynecologists and so forth. In fact, I even had a radio show with a doctor, and he was doing the injection therapy for erections for men. So, I mean, this is not foreign to me, but what you're talking about is very cutting edge, isn't it?
It's really funny, is that pellets have been utilized in the United States since 1939. It started at the University of Georgia Medical College by Dr. Greenblatt, and then continued by Dr. Gambrell, and now Dr. Nitrajan, and whoever follows him. So they've been used continuously in the United States, but the problem with them is that everybody was getting the same dose. And early on, I recognized that this was not the way that it should be practiced. And so I developed and created this dosing formula that allows me to individualize the dose to each person.
Now, so how do you do the test?
How do I
You
do
mean
the
you have to
formula?
have a test to know how much and what the dose is?
We do blood tests ahead of time and take a comprehensive history, and using a numerous number of variables, both in the personal medical history as well as in the laboratory work that we get, and we use those variables to basically put together the dosage, and it's pretty inclusive, and it's once you use the dosage formula, the problems really truly disappear. They come with just that one dose fits all format.
What size is the pellet?
For the females, it's about it's less than the size of a grain of rice.
You're kidding.
No, they fit very comfortably under the skin. After a little local anesthetic, the whole procedure takes a minute or so to do. Patients, run off to work or to onto their daily activities. And the only restriction is for women is that 3 days we ask them not to do any exercise except for walking. And so that's the only restriction, and it works out beautifully.
Where do you insert the pellet?
Side of the hip, where you can't sit on it or lay on it.
So
just it's more it's away from the sciatic area. It's below the belt line, sort of that area on the hip.
And so does it dissolve, and that's when you put another one in?
It dissolves. Yes, ma'am. It dissolves completely away because the only components in that pellet are the hormone itself and a trace amount of stearic acid, which is a naturally occurring fatty acid that we all internally make anyway. And so it's a complete dissolution of that hormone.
This is just, no wonder you're happy. You've really created something. How long have you been doing this with this pellet?
26 years.
Is that right? Oh, well, you look good. I see your picture. I mean, you've been, so you've really figured out something. So you were a gynecologist, OBGYN, for how long?
I finished residency in 74, was board certified in 77. So it's been since 1974 that I've been in private practice. So last year I celebrated my 40th year.
Congratulations.
I'm still going strong.
I know, I can see your face. You're very attractive, and you said you're taking these pellets yourself.
For the past 15 years, yep, and I plan on doing it till the day I die.
I love this. So okay, so let's say someone's here in South Florida. How are they going to get more information? Is there a website? Is it the SOTTO pelletherapy.com? Is that the one I should give everyone?
Yep, absolutely. SottoPelletherapy.com. There's a little map on there where folks can look and put in their zip code, and they can find the person or persons closest to them.
Wow, this is really fabulous. Let me repeat that again carefully so everybody knows. So it's Sotto, SOTTO PELLE therapy.com. SOTTO PELLE therapy.com, or you can call our office if you didn't get that written down. So you are doing this now. I gather you did this, or you're doing it in Arizona, and other doctors who are interested, do they have to be gynecologists?
I prefer, not necessarily. I'd like to have people who are primary care physicians, whichever specialty that might be, who are knowledgeable and accustomed to dealing with hormone therapy, and come in with a unprejudiced mind about the usage of pellets. And I train them intensively here in the. We have 3 training sites for physicians. One in Jacksonville with Dr. Seekine, one in the Midwest with Dr. Maraboy, and then I'm out here taking care of everything west of the Mississippi.
Well, I have to tell you, Dr. Tutera, I need to talk to you again. I have a fabulous doctor who I do all his marketing, and he's a geriatric physician, and he's magnificent. He has a great practice, quite a few offices here. I think he'd be very interested. So you and I can talk after this radio show at some point. I just like what you do, and I understand the importance. We didn't get through a lot of things. We'll have to have some more shows because I don't think I have time actually to, a little bit, they said. Okay, because I was going to ask you how it helps, how does it improve sexual activity, and then all these other things it does, and you won't have time to tell me all that now. But you know it does, right?
Yeah, it stimulates the frontal lobe primarily has testosterone receptors and helps stimulate drive, motivation, and libidos. And by making for women the vaginal area much more lubricated, it's functional. They return to their near normal sexual state. For men, it helps with blood flow into the genitalia.
So
and,
I have
one thing I might mention is that we're doing some tremendous work with Parkinson's patients.
Wow.
Watching them improve substantially because of the hormones help boost dopamine production in the brain. So your fellow that's a geriatric physician would be most interested in that.
Dr. Tutera, I'll be calling you again. Thank you so much. This was wonderful, really. You're a terrific doctor, and I love this. I'll get back to you.
Thank you.
All right. Thank you. Bye.
Bye-bye.